Hello YouTube, I'm Dr. Fox. Today, let's think together about how you can support your pregnant partner. The closer you are to your partner, the more support you give her, the more you'll feel involved in the pregnancy, the birth, and the whole experience of fatherhood. You can do a lot to help with the stress and anxiety that a lot of future moms, especially first-time moms, feel both during pregnancy and in the first weeks of the baby's life. Also, if your partner has bad health habits, which might be harming your baby, she's much more likely to give them up if she knows she's got your support, especially if you're giving them up as well. So, supporting your partner not only means that she's happier, but that your baby has a better chance of being born healthy as well. Okay, pregnancy normally lasts about 40 weeks, counted from the first day of the mother's first period, although babies are often born before this. We divide pregnancies into three-month trimesters, in each of which your partner will look and feel different as the baby grows inside her. Okay, how will your partner feel during the first trimester? You'll probably see lots of changes in your partner in the first trimester, up to around 13 to 14 weeks of pregnancy. Firstly, she'll be more tired than normal because of all the work her body is doing, growing a little human, and she might well want to sleep all the time. Frequently, pregnant women feel nauseous and may vomit, although this is often called morning sickness. It can happen all the time and it can keep going around the clock. Certain smells and tastes might make her feel particularly bad, and she might also get cravings for particular foods or drinks. She will probably have ups and downs and sudden mood changes or periods of irritability, and you might, given the massive life change which is about to happen to you both. It's extra important you're kind and support during these weeks. Okay, what about in the second trimester? In most women, energy levels rise again after about 14 weeks. The sickness stops, and from now until she's about 27 weeks, she will probably feel well. This is the time you will really see your partner's abdomen begin to grow, and at around 20 weeks, she will probably feel the first kicks as the baby starts moving along inside her. A lot of couples start attending childbirth classes and thinking about the birth plan around now. In the last trimester, between 27 and 40 weeks, the baby grows so much that it can feel like a heavy load for your partner to carry around. As her abdomen grows bigger and bigger, she will probably get tired again and maybe frustrated because she can't do all the things she wants to do. This can be an uncomfortable time for a future mom, as sleeping, eating, and moving around all get more difficult as her body prepares for the birth. Most women start their maternity leave during this trimester, and although that gives her a chance to rest more, remember, she will probably miss the company of friends and colleagues, especially if she's already anxious. You can help her get through this period by encouraging her to talk to you, other members of the family, or her midwives. The closer and more supportive your relationship becomes during the pregnancy, the better parents you will be to your baby. This will be a lot of preparations to make to get your home ready to welcome your baby, which you can do together. And remember, it's completely normal for first-time parents to be scared, anxious, and excited all at the same time. Okay, you may wonder what stage of the pregnancy can you get involved? You can get involved in your baby's life right from the start. Look at information with your partner about what's happening in the different weeks of pregnancy, so you can see how big the baby is and how she is developing. There are also really important things that you should do throughout the pregnancy, as these will help both your partner and your baby stay healthy. Eating well is super important during pregnancy, and whatever bad food habits you may have had in the past, this is a great opportunity to acquire the healthy eating habits you want to teach your child. You should take over the cooking as soon as your partner starts feeling nauseous, even if you haven't been doing your share before. The smell of cooking can put her off her food, and you have to make sure she eats what she and the baby need. Also, it's good for you to have your meals together as much as possible so you can check she is eating properly. And even if you don't normally take your share of the other chores around the house, start now. In particular, make extra sure your partner never carries heavy loads like shopping, because that can be dangerous for her. If you or she or both of you have any bad habits, now is the time to give up. If your unborn child breathes in smoke, whether from you or from her, she is more likely to be born early and not grow up properly in the womb. Your partner should not drink any alcohol at all throughout the pregnancy. So if you really need to have a drink, it would be best not to do it in front of her. And any illegal drugs like heroin, cocaine, and marijuana, as well as prescription drugs, if you're taking them for recreational purposes, can harm your baby. If your vaccinations are not up to date, make an appointment at the doctor to get them done, so there is no danger you will pass anything on to your baby when she is born. If it is flu season, October to May is a full job as well. Lastly, help your partner get some exercises, as this is important for pregnant women, but she may feel anxious or worried about doing it alone, especially in the last weeks. Okay, next question. Should you go to the doctor with her? My answer is yes. Go with her and talk through whatever advice you've been given when you get home. In particular, make sure you go to the ultrasound scans with her to get your first look at your son or daughter. It's one of the most exciting moments in the whole 9 months, and you should really experience it together. Some mothers-to-be are advised to have extra blood tests in early pregnancy, and you may be asked to have them too. Doctors need to know whether there's any risk that your baby could have an inherited disease like sickle cell anemia, thalassemia, or cystic fibrosis, which means they may have to ask you about your family history to see if anyone you're related to, anyone has ever had these diseases. Okay, next question. How should you expect to feel while your partner is pregnant? Men who know they are going to be fathers can experience a huge range of feelings. Just because the baby isn't inside you doesn't mean you don't have an emotional reaction to the pregnancy. And if the pregnancy hasn't formed, both you and your partner may have mixed feelings. It's natural to be worried about the thought of all the new responsibilities of being a father, however old you are. Having a first child in particular will change your life, and change can be scary even when it's something you want. On a practical level, you may be worrying about money. Maybe your income is going to drop with mom at home and the extra expenses a baby brings, or the cost of childcare when both of you are back at work. It's worth having a look at the online money advice services so you can plan your financing and check whether you can claim any benefits. Okay, next question. Should you go to antenatal classes with her? Your health provider will give you information about antenatal classes that partners are welcome to attend. These are very useful, as the more you know about what to expect when your baby is born, the more you can help and be involved. Classes are also a good way to meet other couples going through the same experience as you. Okay, next, what's the birth plan? A birth plan is the plan you and your partner put together while she's pregnant, so your health providers know as much as possible about how you want the birth to happen. For example, you should be there. Putting together your birth plan is also a good opportunity to get on the top of the practicalities, so you're completely prepared when she goes into labor. If possible, go and have a look at the hospital so you're familiar with the layout and you know where to park and where the maternity ward is. You can also ask if the hospital has any policies about who can be in the room while mother is in labor, whether you are allowed to stay overnight, and if it is okay to take pictures or film the birth. A lot of women state in the birth plan that they do or do not want pain relief, or do not want to have a cesarean delivery. Discuss your partner's choice with her, but remember, it's not uncommon for women to change their minds when they actually go into labor, or for medical staff to suggest changes if there are unforeseen difficulties, and you should be supportive if it happens. Okay, next question. What other preparation should you make for the day of the birth? If you are intending to drive your partner and new baby home from the hospital, or one or your friends or relatives is, make sure you have a rear-facing car seat installed, because otherwise you will not be allowed to drive with the baby in the car. Next, can you have sex while she is pregnant? Although there's normally no medical reason not to have sex, remember that your partner may have a lower sex drive than usual, or that sex might be painful for her. During the early months, in particular, her breasts may be very tender and she may just not feel like it. If you try and have sex and she feels any pain or start bleeding, stop immediately. You may need to find new positions which are more comfortable for her. Even when pregnant women want sex, some men feel uncomfortable about it, maybe because they are not used to their partner's new shape and are worried about hurting her. If this is you, reassure your partner that it's not because you don't like the way she looks anymore, and find other ways to be close and intimate. Okay, next question. Can you do anything to help her when the labor started? There are lots of things you can do to help during the early stages of labor, but one of the best is just to distract and support your partner, especially if the contractions are painful. Talk to her, play games with her, watch a film with her, ask if she would like a shoulder massage, a back rub, or something to eat or drink, and time her contractions. Okay, next, should you be there during the birth? These days, most people stay with her partner while the baby is born, but both of you have to be happy about this. It's certainly not compulsory, and medical staff will not put any pressure on you. Talk to your partner, see what she wants, and remember, a friend or relative can be there at the birth instead of the dad, and that's completely fine as long as you are all happy with the arrangement. And remember that your partner will have great support from hospital staff, whether she's with you, with someone else, or by herself. If you do stay with your partner while she gives birth, you will have the amazing experience of watching your baby come into the world. The baby may be placed straight on the mom's chest or belly, or the midwives may wrap her up and then give her to you or mom to cuddle. Hold the baby close. This can be an incredibly intense and emotional moment, so if you burst into tears, don't worry at all. At the same time, if you feel numb, that's fine too, because the experience takes different people in different ways. When it's time to leave mom and baby and go home, you may find it difficult to rest, or you may be exhausted. Okay, next question. How can you support your partner after you get the baby home? Your partner will probably be very tired during the first days and maybe sore as well from the birth. So, you should do everything you can to let her just rest and feed the baby. If you have relatives and friends close by who offer to help, it's a good idea to accept and not try to do everything yourself. If you don't, and your partner is just relying on you, ask if you can take some time off work. There are a few things that you should particularly consider during the first incredibly special few weeks when you are becoming a family and learning how to be parents. First, Your partner will probably get tired more quickly than usual, so keep an eye on the number of visitors and how long they stay. Do as much of the housework as needs doing to keep you all comfortable and healthy. But remember, you don't have to keep the place spotless. Second, make sure you take solo care of the baby sometimes so you can bond with your child and make sure mom gets a proper rest. Changing nappies, taking the baby out in the buggy, and bathing and playing with her are all part of being a good father. If your partner is not breastfeeding, take your time feeding the baby and make it your job to sterilize the bottles and make up the formula. If your mom is breastfeeding, which is best for the baby, there are lots of ways not to feel left out. Bring her a snack and a drink and sit with her while she feeds your child. You can be the one to burp and change the baby after she's finished feeding and cuddle her to sleep. If your partner starts expressing milk or pumping it into a bottle, you can bottle feed. It's really important you don't pressurize your partner to have sex with you. Although it's unlikely that sex will cause infection or bleeding after about 2 weeks from giving birth, a woman can be sore for much longer than that, especially if the birth was difficult and she had to have stitches. She may have been advised by doctors not to have sex for a certain period of time so she can heal properly. So leave it to her to set the timetable and find other ways to be intimate together. Last question. What happens if your partner gets postnatal depression? A lot of mothers can get depressed or the baby blues, and if this happens, she will need extra love and support from you. But remember that dads can get depressed and anxious too, and you have to look after your own mental health if you are going to look after your partner and child. Tell your partner what you're feeling and listen to her when she does the same. If necessary, go to your doctor and remember there is no shame attached to feeling down. Okay, thank you for watching. See you soon.